Primary health care is just one of many health care challenges to be tackled by the government. With more than 8,000 deaths in British Columbia since the public health emergency was called in 2016 due to toxic drugs exposing our lacking mental health and addiction services, we have been trying to get this BC NDP government to act with urgency to decriminalize, destigmatize, and provide an accessible, safe supply to protect lives. The Minister of Mental Health and Addictions rises in this Assembly to openly discuss her initiatives often. However, the response has never really been urgent enough, nor has it gone far enough. Many advocates openly and regularly question the BC NDP government's commitment to solving these issues. The Ministry of Mental Health and Addictions does not stand on its own. It is within the Ministry of Health. The Ministry of Health delivers through health authorities much of the programming for mental health and addictions. The Minister of Health speaks very little on mental health and addictions. He rarely mentions these words. And, frankly, it's left many wondering whether he supports the initiatives or whether he is an obstruction to them. I've tried in question period to get his perspective on the record, yet he stayed seated. And then I was called a bunch of names on Twitter for apparently undermining the authority of the Minister of Mental Health and Addictions by asking the Minister of Health this important question. So, if the Minister of Health is indeed not an obstruction and an impediment that some consider him to be, then he needs to take the opportunity in this Assembly or one of the many media interviews he does to provide unqualified support for decriminalization, destigmatization, and safe supply programs in British Columbia. There is no harm in our Minister of Health saying those words on the record.